Hi everyone, welcome to this page or this channel. It's a delight speaking to you again today. I'm going to be talking to us today about epilepsy. Like you all know, this is Health Matters with Dr. Angie. Epilepsy. What is epilepsy? I want to just give us an overview, something you will want to know that will interest you about epilepsy. And in my other video, I will tell us about how to help people that have epilepsy. When you come across them, what do you do for them? What are some of the common practices that we do that is not right? And what can we do right? So let's get started. Epilepsy is a non-communicable disease of the nervous system. Remember, I've talked about the systems of the body. So the nervous system, which includes the brain, the spinal cord, and the nerves, is where epilepsy affects. I say it's not communicable because you can't get infected. It can't pass from one person to another. It's not infectious, so it's not communicable. But it's a chronic disease. So that means it runs a chronic course. When it comes, it has come to stay, unfortunately. But that doesn't mean that people that have epilepsy don't have hope. No, they do. So it's a chronic non-communicable disease, and it happens as a result of disturbance in the nerve activities of the brain. So the nerve activities have a way in which they function. They pass information from one part of them to another, and the brain coordinates it and sends it back to the other parts of the body. But in epilepsy, there is a problem. There is a disturbance in the nerve activities of the body. Worldwide, epilepsy affects people all over the world. About 50 million people all over the world suffer from epilepsy. Okay, so it's a problem that cuts across every part of the world. But of course, like we know, people in the developing countries suffer more of the effects because of course, reasons, obvious reasons, like poor healthcare, poor follow-up, and all that. But we'll get to that. Epilepsy needs to be properly diagnosed for it to be well handled. There is a way to help them, ensure that those seizures don't keep coming. Because if you have seen someone with epilepsy, you know that epilepsy involves continuous seizures. You see the hands and the legs moving, sometimes their eyes and their mouths moving, they are jerking, they are foaming. Okay? So there are things that can be done to help them reduce those seizures. So it's characterized by recurrent seizures. The seizures are recurrent. That is, they come, they go, or rather, no, they don't go, but they come, and after some time, the person has it again. After some time, it comes again, the person has it again. So now you understand what I mean by it runs a chronic course. One seizure does not signify epilepsy or does not diagnose epilepsy. When you see somebody that has seizure only once, you don't just go and say that the person has epilepsy. No, it has to be recurrent. Remember, it's a chronic illness, so it's recurrent. So one seizure alone does not diagnose epilepsy. One problem that people with epilepsy have is the stigma. Oftentimes we stigmatize these people. Oftentimes we talk down on them. Oftentimes we cajole them. Oftentimes we say things that hurt them psychologically and emotionally. And you see, this stigma is one of the reasons why they tend to hide away from the society. They tend not to do well. They tend not to come out when they have a problem. Now, let me wrap up this session by telling us some of the signs and symptoms of epilepsy. Signs and symptoms depend on the part of the brain that is affected and how the impulse is spread. Because a part of the brain is affected, if it spreads so wide in the brain, then you see it's going to be more generalized. It's going to be affecting more parts of the body, But if it is not that generalized, then it will just affect the part of the body where the disturbance is seen. So you can see signs like seizure, like we all know, they usually have seizure. If we have seen somebody having epilepsy, you know that the commonest one that we use to identify them is seizure. This person is having seizure, that is fit. The person is jerking. That's the commonest one. But there are some other symptoms like unconsciousness. They can be unconscious. You can have sensation disturbances like visual disturbance. Some of them have problem seeing well during that time. Some of them have hearing and taste disturbances. These are still part of the signs of epilepsy. Some of them have mood disturbances. Some of them have incontinence. When they finish, you see them, they wee and they poo on their body. These are all signs of epilepsy. And they tend to have more physical problems. The physical problems are due to the injuries that they sustain from the epilepsy, like fracture. Some of them in the course of the feet, they fracture their bones. Some of them sustain bruises. Some of them have risk of even having burns. Some of them in the course of the seizure, they fall into fire or hot oil or hot water. In the next video, I'll be talking to us about some of the causes of epilepsy and possibly what we can do when we see someone that has epilepsy. Remember to share, remember to like, remember to follow this page for more health tips. Once again, this is Health Matters with Dr. NG. Bye.